All right. Well, hello, everyone. Thank you for coming to the kickoff event of ISSA's Info Blitz. This is the cultural adjustment session. So we're super excited to welcome our guest speakers today. We have Mary Davis, who is the Assistant Director at the Center for the Studies of Languages and Cultures. And we also have some representatives for the University Counseling Center. We're going to be kind of delving into some intercultural communication, how to strengthen your intercultural communication, and also some resources available if, things like culture shock or, if you need any assistance through the university. So I'm going to turn it over to Mary, who's going to take it away.
Well, thank you, Zena. Thank you guys for coming today too. We were talking about how it's a bit colder today than it has been, and that can be very dissuading from stepping outside and going any place. So I appreciate the effort it took you guys to come here on a Monday, no less. So like Zena said, my name is Mary. I am the Assistant Director at the CSLC. So a lot of what I do is centered in developing intercultural competence, specifically through linguistic immersion and linguistic diversity, learning a foreign language essentially. But it really is something that we're all doing all the time. So I'm happy to be here and get to meet some new people and get outside my comfort zone a little bit. So I'm gonna kind of kick us off for the first like 25 to 30-ish minutes, really just getting into what we even mean when we say cultural adjustment or culture shock, to kind of set a context for what we're talking about experiencing today, and kind of start exploring what that looks like for you as an individual person, what it looks like in general. And then I'm going to pass it off to my colleagues at the University Counseling Center, and they are going to share with you their expertise in terms of how resources that might be available and better understanding from perspective. And then we'll leave time too at the end for any wrap up, any questions and answers, anything that wasn't clear or needs to be clarified. I'm good. This one. Is it locked too? Nope. There we go. Sorry, not that. Great. So let's go ahead and start off with just a little bit of like a word association game. So what is the first thing that pops into your head when you hear the word culture?
Culture of the World Association. You're asking about the culture of the World Association.
The word association is the activity. So when you hear culture, the word, what do you associate with culture?
Other people's way of life.
Perfect. A way of life. What else comes to mind? There are no wrong answers, by the way. It's an interactive session, but no wrong answers.
Food.
Food. Thank you, Zainab. Me as well. Food is always on my mind, so it doesn't take much to be for me to associate that with just about anything. What else? Language.
Topics involved in conversations.
Okay, topics. Yeah, okay, so not just the language we're speaking, but the way we're speaking. Absolutely. Yeah. Something which runs through it. Ooh, I like this. So things that we have in common or share, right? Okay, so it could be like the food we share or the language we share. Music, absolutely. Yeah, fantastic. Thank you guys. Not just for being here, but also for indulging me by answering. I realize we're a small group today and that puts a little bit of pressure on you guys to speak up, but I appreciate it. So absolutely common responses that we get, when we're doing a quick word association with culture. Food, I did intentionally put that at the top. Things like music, our beliefs insofar as the rituals which represent them. People or specific people may come to mind, a certain group of people, like festivals that we may see or participate in. Diversity, again, usually as it relates to how we see people or experience going to a new place. Things like art, languages, history, or even like cultural specific icons. So if you were thinking not just of culture at large, but French culture, you may think Eiffel Tower, baguette, right? And these are the things that our brain normally jumps to, because these are the things that we typically first experience of a new culture, right? So this is a very common metaphor or analogy for culture. If this is not the first time you've seen it, I'm sure it won't be the last either. But I do like the iceberg as a metaphor for culture, because it's going to kind of set the context of what we're talking about when we say cultural adjustment. So a lot of what we first think of, this word association that we just did, is what shows up at the tip of the iceberg. These are the things that we can touch and taste and experience and partake in, and the languages we can speak and the people we can talk to. Beneath the tip of the iceberg, so the part underwater, is a little less tangible. But these are certainly things that we feel and still experience. So it can be, I think we were getting at it a little bit in terms of like the way that we communicate, not just the words what we're saying, but what our words really mean or how they're perceived. These are just some examples. It is not an exhaustive list. I'll show the iceberg again later, but I'm not going to read everything off. Just a few examples. So for me, when I first came to Notre Dame, one thing that stood out to me very much was kind of a way of communicating, also in terms of touching as a way of communicating, right? So you're nodding, yes. We may have had completely opposite experiences though. So one of my first days here, one of my colleagues welcomed me by giving me a huge hug. A person that I did not know very well and like couldn't really even remember her last name gave me this huge hug. And I was like, this is not the way that I'm used to communicating with my colleagues. So that was still like kind of up here. You could say it's a bit of a language that we speak. It's close enough to the surface that I actually tangibly felt it. But there was also an emotional response that went a little bit deeper in terms of like, this is something I'm adjusting to right now. Okay, so that's like just my example. I'm going to keep referring back to. If anything comes to mind when you see some of these, hold on to that thought, because we're going to talk about them in a second. One thing though that I did want to explore a little bit, if we're looking at this as a metaphor, an iceberg, as a metaphor for culture, the way that we're dividing here, what the waterline itself actually represents, is important for today's context. What kind of divide might you be seeing here between what's up at the top and what's up or down beneath? Specifically, maybe in the terms of how we learn these things or how we practice ways of communicating versus the actual words we speak, for instance.
I think things in the top are visible, or like obviously not only visible, like lookable or hearable, like languages, architecture, while things below are blatant, not visible. Yeah,
absolutely. And please.
I think the top are like specifics, and the bottoms are like the vehicles with which people carry out, like actually manifest those things, like they do that with the bottom. That's the basis.
Yeah, absolutely. So you're seeing a connection between some of what's beneath, right, as sort of the foundation, and then it manifests in a certain way at the top. Does that resonate with I agree. I think those are both fantastic, right? Because I think you're saying this essentially along the same lines as the things that are a little bit more latent, the things that are a little bit deeper, then sometimes come to a tangible sense or manifest in a way that we can touch, taste, see. At large, what we're saying is that culture is what we share, right? A set of behaviors, beliefs, values, assumptions that we share with members of a group. right? So we can share all of those characteristics, or at least a fair amount of them. It might be, yes, we all share food, or we all share the same sort of sense of time, right? We all sort of agree that showing up 10 minutes late is fine. The key distinction, though, that I'm trying to get at is how we learn it is either explicit, usually, and therefore a little bit easier for us to contextualize, or implicit, right? So the language, we all went to school and learned how to read and write our names and speak our languages, but what we implicitly or unconsciously learned was what those words mean when we say them to other people, right? When I hug a colleague, it means this certain thing. Nobody ever told me that. I just sort of implicitly learned that, right? So in that sense, the more colloquial definition is culture is just sort of how we do things around here, wherever here is, right? Around here, maybe we just hug our colleagues, right? And around there, wherever I was before, that wasn't the way we did things. How's that sitting? Cool. Okay, so I want to keep this one in mind specifically. So when we're talking about adjustment, it's how we do things around here, here being different from where we were before. I was not at Notre Dame before, but I was still in the US, right? Some of us are coming from very different backgrounds, may have been in the US before, but not specifically in Indiana, may have not been in the US before. We're still adjusting to here as a context, right? So this is my other analogy of what walking in our culture feels like to us. So if you're standing here at the beginning of this bridge, and I ask you to walk to the other side, how are you feeling about that task? Any problems? Fine with that? What if I ask you to walk to the other side of that bridge? How are you feeling now? Some head shakes. What's the feeling that comes up if I say, please walk to the other side here?
Risk.
Risk. It feels risky or dangerous. Unsafe. Anxiety. Giving you a little bit of anxiety. Is anybody fine with that one? Which would you prefer, though? Typically. We prefer this one, right? This is the one where we see the footing, we know what's going to happen, we can clearly see where we're going. There's some nice flowers, doesn't look like it's very far to fall, feels stable, right? We look on the other side, it feels dangerous and unstable, our foot might fall through, there's some pretty swift looking waters underneath, right? So that's my second metaphor for when we're talking about the way we do things around here. Being culture, cultural adjustment is changing the way that you do things around here. And it can sometimes feel like changing your path entirely. So a lot of those feelings happen to overlap sometimes between being asked to do something like walk across this bridge, even if it's something kind of inane, like getting used to your colleagues giving you a hug in the mornings, right? It still feels a little less than stable. So as a small group, we're all of us, I think we can just whole group it here. Is there anything that comes to mind for you since coming to Notre Dame that feels like a time when you maybe tripped a little bit or brushed up against something beneath the iceberg, akin to my collegiate hug story, perhaps? What comes to mind for you?
People do a lot of small talk, like at the supermarket, and like they talk to me, I feel like, what? Why do they talk to me? Because they don't know me, I don't know you.
Mhm.
But you ask, how are you? Like, I know it's very superficial conversation, but I feel like in my country, which is Japan, we don't talk to strangers.
Mm.
Like, even how are you? No, how are you to strangers?
Mhm.
No, good morning to strangers. So I feel it's a bit awkward.
Mhm.
Even now, I know they will say, they will speak to me, like they will tell me, how are you, ask me, how are you, or anything, but. And I can answer to those, small talk questions, but still I feel like, oh, I don't want to talk to them.
Mhm. Yeah, it can feel sometimes even like a burden or can feel like awkward. Does anybody have similar experience? Answering, how are you? You're like, fine, good, yes. Hello, also?
We got an issue with timing.
Mm.
Now greatly using this.
Mhm.
In Kenya, if you are a movie, you can like this.
Mm.
Then I came here and trying to do this before.
Absolutely. Yeah. Can feel awkward at least, maybe not even like as dangerous as the bridge, but certainly like something's happening here that makes me feel a little less than stable, a little less than certain. Other examples, things that come to mind?
I think similar to you, when I am from the US, but I moved from sort of more of the East Coast to the Midwest. And I've noticed there's lots of talking with the grocery store cashier.
Oh, it's even different in the US? Like.
Well, by region, yes.
Oh.
Yes, so when I came to the Midwest, I was like, wow, that you talk to a lot of people you don't know. And I noticed that people make eye contact with you, like people you don't know, and I was very not used to that. So I would walk down the street and if I didn't know you, I'd just keep my eyes down. And then I realized like, oh, people perceive that as impolite when I'm like, I just don't know you. Like, we don't talk to strangers and we don't make eye contact with strangers. And then I realized like, oh, okay, there's an adjustment period here where, I'll need to move eye contact and talk more.
Yeah, and I can certainly feel uncomfortable, especially considering all the other things you're doing. You're studying full-time, you're, potentially working, you're getting all of these new experiences, and then on top of that, you have to talk to people at the grocery store. Seems a bit much sometimes. You are not alone. Similar to Joseph. So it's definitely sometimes regional and can feel awkward, burdensome, uncomfortable. And that's brushing a little bit beneath the surface, right? So there's this idea of adjusting being kind of an up and down, a U shape, right? So when you first come to some place, you're usually excited, you're focused on the top of the iceberg, you're trying new foods, you're going to new places, it's pretty cool that people are speaking a different language potentially. And then you might have more adjustment, more brush ups against that stuff beneath the surface that is getting at a little bit of uncertainty, a little bit of instability. Making small talk at the grocery store, hugging your colleagues, different ideas of how we talk to our professors. Has anybody run into that one yet? Not sure how to address our professors. We still run into that one sometimes. Some of them go by first name, some of them go by doctor, some of them don't say it at all, right? So we get in this, every time we feel a little less stable, a little less certain, we kind of come down a little bit. And then there's an upswing, we adjust, we get used to people talking to us in the grocery stores, we anticipate the morning hugs from our coworkers. And then we feel like we've kind of stabled out when we get to a new place and we're like, okay, I know what's happening here. But in reality, it kind of just up and down. It's not like a U curve, it's like a continual ups and downs curve, right? And I want to point out that as time goes on, what we're usually first adjusting to or conscious of adjusting to is some of that top of the iceberg, the physical, tangible things, right? And certainly they're connected to some of the things underneath the iceberg, but we're really kind of focused on the actual talking, the actual hugging, right? And as time goes on, that can kind of wear on us a little bit. That constant uncertainty, that constant awkwardness, and it can become much more of an emotional adjustment, right? Because we're not always aware of what really it is under the iceberg that we keep brushing up against. We just know that we keep feeling uncertain or keep feeling uncomfortable. Questions so far? Seems fine. Kind of all over the place. Okay, so my parting question essentially, when we're in that circumstance where we are feeling kind of uncomfortable, uncertain, we're not really sure what to do, we are being asked to cross the second bridge. What is your natural reaction? Your natural response to an adjustment? And there's no wrong answers. Reminder.
Mean when you feel uncomfortable with something.
When you're in an uncomfortable situation, what do you tend to do?
I avoid it.
You avoid.
Sometimes I don't go to the supermarket where people are at the cashiers. Instead, I go to the supermarket where the cashiers are automated, no person, it is more comfortable to me.
Yeah. Just avoid the situation entirely. Can't make small talk if I'm using a machine. Maybe I start avoiding my coworker and I like come in before her and close the door to my office or something. Or if we're not sure how to address our professors, maybe we just don't. And we just say, hi, I have a question. You. Sir, ma'am. What else do you think you do maybe sometimes when you're uncomfortable?
Maybe when the situation actually comes, like this, like you have to do it, like I'll be like, I think twice, like twice, maybe more, a lot of times, removing it and actually missing out on a lot of opportunities. Actually, so like maybe you have a chance, like maybe you rehearsed a few times, like the small talk, all kind of stuff, and there's gonna be like a window, like a 5-second window or something, like when someone's like making eye contact with you, like you're ready to do it, but like I think you're like twice maybe then, and then he's not looking and he starts talking to someone else, and then you feel like you're at a loss, like I just missed out on an opportunity to actually make something different, like for myself, to improve. Yeah, that's what I think sometimes.
Yeah, there can definitely be like a feeling of loss or missing out. Even the time that you put into in that circumstance preparing, right? And then losing out on that time because you felt like you had missed an opportunity, right? I also really resonate with that feeling of kind of like freezing up in the moment, right? It's like I have a window and I missed it. Next time. Right. Yeah, because there's certain things we can't avoid all the time, right? We can't stop going to the grocery store. Maybe sometimes there's a grocery store we have to go to and there's not, there's like certain unavoidable circumstances for sure. And these are all relatively lighthearted instances that are happening right now at the beginning, and we can kind of lightly talk about them. But certainly as time goes on, there is more interaction and a little bit more deepness with how you might be responding to something at that bottom part of the iceberg. Things like, what does friendship mean to me and the people around me? It seems different. Having a relationship with somebody, problem solving. Talking to my professors about this problem I'm having in class, who seem to be having different approaches. Right? And these can be really big, impactful things, much more so than me just kind of dodging out of the way, holding a cup of coffee defensively as my coworker goes in for the hug. Morning, right? So I'm going to kind of leave off there, establishing that this is generally what we are talking about when we say cultural adjustment. and generally some of the challenges that we're facing, right? When we're looking forward to taking steps towards what adjustment looks like best for us as individual people and practices that we may be able to assume, I will turn it over to Josephine and Chiyu.
Oh, this fancy thing. I just hit this arrow. Okay. So, hi, I'm Dr. Josephine Dickinson. I'm a staff psychologist at the University Counseling Center. And so we're going to go over some issues related to culture shock, again, some emotional ways of adjusting. And then we're going to talk about some resources that we have and resources that are available around campus. So as Mary was talking about general cultural adjustment, there's also a period of culture shock. So a clash between one's personal way of viewing and interacting with the world and the new cultural environment. So you can start to struggle and become really incompetent in a new cultural environment where everything is different from home, right? So that's that emotional piece of like, you know, feeling a little disoriented about all the new. It can be characterized by frustration at the difficulty in learning so many new things at once and disappointment that adjustments must be made. Sometimes you feel like you will never adjust, you don't like the things you see, or perhaps you think it was a mistake to move so far away from friends and family and home. It is a developmental phase that is both common and expected, even though it can create a level of emotional distress. It's also common that you may not experience it at all or experience it different than others that you know. So Megan Brown, who is the director of McWell, she came up with this slide. Which of these time periods was the most difficult time for you in your adjustment to the United States? So you can see the majority of the people said less than 3 months, and then 3 to 6 months, and then 6 to 12 months. So you can see between 3 and 12 months is when most people are adjusting, with the most difficult part being right at the beginning. How long have you felt like you've been adjusting? I know you just got here, what, like a month ago or so? Where do you feel like you might fit in here? Or anticipate fitting in here? Any guesses for you?
Well, I didn't come to the US, but I've only been at Notre Dame for less than a year, and I feel like I'm still adjusting to some things. I was previously in New York, and coming to Southern Indiana, New York City, and coming to Southern Indiana has been a huge adjustment. And I'm like, I started October 11th of last year, so I'm like coming up on 1 year,
Yeah.
and sometimes things happen, and I'm like, oh yeah, no, I have not adjusted to this yet.
So this just gives you an idea around a time frame of what you can expect. Things will be the most difficult. So when they start even a little bit. So here's some common signs of culture shock. There can be sadness, obviously wanting to go home, homesickness, feeling left out or misunderstood. Sometimes it can obviously be really difficult to make friends and find your group. Could be bored, social withdrawal, irritability, negative feelings toward domestic students. You could be sleeping more, sleeping less. You can also experience what we call psychosomatic symptoms, which are physical ailments, sickness, body pain, which could actually be physical, but can also be emotional manifestations of how you're feeling.
So, my name is Jie Yu. I'm also one of the psychologists from the counseling center, and then I'm living here just like you all. So, yes. So this is just like a different model to look at the cultural adjustments. So it's very similar to what Mary shared, the U curve. but it's more like an extension. So the idea is like every time when you transit into a different space or you meet a new group of people, you will experience some kind of cultural shock, or you need to go through this adjustment, right? So the half part of the half part is like even when you go back home, right? After you have been in the US for 1 year, 2 years, 3 years, you learn something new. And then when you go back to your country, you probably will experience another period of cultural shock. Right? Like for my sister, she was in the US for 6 years, and then she went back to Taiwan, and then she had a lot of like challenges to adjust. So she always said, no, this is not how we do things in the US. And then my mom was like, no, you are in Taiwan now, you are not in the US. So, so this just like I want to show you like it's normal, right? All these like adjustments, they are normal. You will experience it even throughout your life, right? Every time when you move into a new place or meet a new group of people. And then there are several factors that might influence our experience of adjustment. So for example, like before you come to the US, what's your expectation about the education in the US? And then what's the reality here? So some students might say, oh, when I was like back to my country, right, I just need to stay there and then listen, right? Listen to the lecture. I don't have to do anything, and then I will be fine. But the reality, part of the reality, of education in the US is like the professors, they really want to hear your voice. They want to know where you are, how much you learn, or what questions you have. Right, so there will be some like difference. And then also the cultural differences and similarities between your country and US or and Notre Dame. So let's say if you are from a European country, you speak English, and then the food is very similar, then you probably feel like, oh, my adjustment is pretty smooth. But if you are like me, right, I'm from Taiwan, we don't eat cold food a lot, right? So everything needs to be stir fried. We don't drink the uncooked water, right? So when I came to the US, everything I need to adjust. And then like a language proficiency, and then also like your relationship with like a domestic students or Americans. And then other things might be like your personal traits or your attitude, right? Are you openness? Are you curious about a new culture, or are you willing to seek help? And then also like if you have like ever experienced some kind of like discrimination, microaggression, then you probably will, the hurt, right? You will probably make your like adjustment a little bit like longer. And then the other thing is really out of our control, which is the political climate and the immigration law. And then because like this is so normal, and then we are not going to avoid it. So these are just like some ideas for you to manage your stress, right? So I think the first one, I really encourage you, or probably you already do that, right? Seek immediate like comfort, right? It might be comfort food, right? I have some sweet, then I feel much better, or I listen to music, or I watch the Korean drama or whatever, right? And then also like some like a basic coping strategy, like the deep breathing, the grounding techniques, it will also count. I also want to highlight like connect with others, and especially other international students. I know like sometimes it's like easier for us to connect with someone who may come from the same country, like someone who can speak Mandarin, make me comfortable. Yeah, but I will really encourage you to try, to connect with other international students as well. The other thing I want to highlight is like self-care. I know like this sounds like simple, but having a good sleep, eat healthy, and then exercise. And I also understand like if we do this, it did not take our challenges away, but it did help you to, to build like your capacity to cope. And then also like really be patient with yourself. Right? Think about like how old you are now, right? You spend maybe 20 years or 25 years back to your country, then your culture. But now you are here for only about like 1 month or 2 months. So like really be patient. It really takes time. Yeah. And then this is just like one strategy I want to share with you to hopefully you will like facilitate this like the cultural learning. So when you feel like something happened, it really hits you, you feel confused, it doesn't make sense to you, you feel hurt, right, or frustrated, right? Try to like separate the fact and then the feeling, right? Yes, I did something, I feel bad, right? So it's your feelings, and then it doesn't equal to the fact like you are not good enough. So I can really separate that, and then try to analyze like the how your culture, right, might affect the situation, and then also like learn kind of investigate like the US culture. So like one thing I can share is like this morning I attend the new hire orientation, and then we were asked to introduce ourselves. So I was like, oh, hi everyone. So my name is Jie Yu. I'm an international student. And then I post, I was like, oh, but I graduate. And then I move on. So oh, now I work in the counseling center. And then after that, I feel so embarrassed. I was like, who will say they are international students doing the new hire orientation? And then I start to think, of course, I kind of like, okay, I feel embarrassed, but it doesn't mean I'm not good enough, or it doesn't mean everyone will judge me because I make a very teeny mistake. And then I try to think like, oh, why do I say I'm an international student? And I think it's because like, I have been in the school for the past 6 years. And I'm so used to like, hey, yes, I'm an international student. I'm from Taiwan, right? So it's like how my previous, kind of culture kind of influenced me. And then I investigate how other people do things. So I kind of like, okay, next time, right, I don't know, maybe take a note, right? But the things I want to say when I try to introduce myself.
So everything we've talked about thus far would be considered sort of normal, that you'll have some adjustment, you'll experience some culture shock. There are going to be ways that you'll need to take care of yourselves, coping skills you'll need to develop, to help this process. But we also wanted to highlight when the adjustment process goes from quote normal to concerning. So there are some warning signs that you can look for in yourself or others that could make you think that maybe you need some additional help or support. So here are some 10 common warning signs that maybe you're not adjusting as well as you had hoped. And again, or you see a friend having an issue as well. So feeling sad for more than 2 weeks. So we put a time frame on it because we're all going to feel sad for, days here, days there. But if you're having persistent feelings of sadness for 2 weeks or more, then that's something that you want to really think about getting some additional help. If you're having some severe or out of control behavior, let's say it's not typical for you, but you start expressing anger, or you're yelling at people, for example, that could be a problem. You have sudden overwhelming fear for no reason that you could see or come up with an example. You have significant weight loss or weight gain. That can also be shifts in appetite as well. You're more hungry or less hungry than you would normally be. Another obvious concerning sign is having thoughts of suicide or trying to harm oneself or somebody else. And again, thoughts of suicide can range from a fleeting thought of what would it be like if I wasn't here, to something more severe, which would be, I actually want to die and I have a plan for how I'm going to do it. The last 5 here are common warning signs. If you notice an increased use in drugs or alcohol, maybe you're somebody that doesn't drink that much or use drugs, and then you came to the United States and you either start drinking and using drugs or you start using them more. You see a drastic change in mood or behavior. You have difficulty concentrating or staying still. So you're finding in your classes that you're not focused, you're not retaining the information, you feel just like fidgety and restless, maybe you have to get up a lot. Worries or fears that get in the way of daily life. We talked a little bit before about avoidance. So there can be sort of that a normal avoidance piece that we would all have. But this is where you're not going to class. You're not meeting with your advisor. You made social plans and you are frequently canceling them. And then lastly, believing things that aren't real. So we're talking about moving into if somebody's having psychosis, for example. So you think that somebody's following you when they're really not. You think somebody's out to get you when that is not the case. Those are some examples. we highlight that 2-week period, and we also highlight tasks of daily living. If you are not able to do tasks of daily living on a regular basis, and it's been 2 weeks or more, you want to look at, are you able to get out of bed every day outside of being sick or ill? Do you brush your teeth? Do you take a shower? Do you do your laundry? Do you get to class on time? Do you meet with your professor when you say you will? Can you fulfill your academic responsibilities? Can you engage in social activities? So these are, what we would hope our daily lives would look like, that we could actually do all of this. But if you're finding in a 2-week or more period that you're not able to do at least some of these, then again, that would be cause for concern.
So since we are from the counseling center, right, and then, yeah, so we are going to try to talk about counseling, right? So kind of curious about like, what is counseling, right? What's your idea about counseling? Anyone share?
Like therapy.
Mm-hmm. Yes, 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 thank you. Mhm. Yes, yes, they are all correct, right? So this is more like kind of like the definition. So basically counseling is a collaborative effort between the counselor and our clients, which are our students here. And then so it's not one way, right? It's not like, oh, the counselor will tell you what to do and then you do it, right? It's more like we work together. And then the idea is like to help the client to see things differently. Right. So again, it's not we tell you what to do, how to think. It's help you to come up with this realization, right? To know like, oh, why I have this difficulty, or this is my strategies. How can I improve? So it's from you. We also want to highlight like it's not advice giving. It's not just talk. Yes, we talk a lot, right? A lot of conversation, but I think the mechanism behind the talk is like make you realize, right? So it's not, again, it's not we tell you what to do. And then also we don't make decision for you. We want you to make your own decision. Yes, these are the things I want to change. Yes, this is the action, this is the plan I'm going to try next week. And then also I just want to highlight like our service is always confidential with a little bit like exception, but yeah, and then we are not there to judge. The other one is like it's free to our students. So really encourage you. And then I'm going to talk about like some common thoughts people usually have. So the first one is like the people usually think counseling is only for people who are crazy or have serious emotional concerns. So agree or disagree? Or how often do you think this would?
You won't hurt our feelings.
Everyone needs that.
Yes, thank you. Yes.
I think counseling is one of the greatest things.
I think, like, mentally ill, like, patients, what they do is they need treatment. I think that there's a difference between like actual treatment and counseling.
Mm-hmm. I am not sure about that one, but maybe I'm wrong. But the overall idea is like everyone will benefit from counseling. Yes, like there are like some people, they will have like more severe like mental health issues. Yes, they utilize counseling, right? But even for like for us, right, with like our academic stress, with my relationship with my professor or my roommates, everyone can benefit from counseling.
If I could just stop you there. I think maybe what you were talking about is there's counseling, which seems maybe for like more mild issues, and then therapy, which is for more of those moderate issues, and then treatment, those more severe issues. And I think treatment usually for us, we think of it as maybe you need to go to like a more intensive type program, maybe not at the university, for example.
Yeah, maybe an institution.
Yeah.
Yeah. Oh, yeah. Thank you.
Yeah.
And then the other one is like, sometimes people will think people who are in counseling are weak, right? Agree, disagree.
The counselor or not, patient.
Counseling, like, people, yeah, people who seek counseling.
No, I don't think
Yeah,
they're powerful.
yes, yeah, so people who are in the counseling means they have something to deal with, they have something, right, they can work on. But it doesn't mean like they are weak. And then in fact, seeking help really requires a lot of courage. So I don't think like people who are in the counseling are weak. It just means like they need some extra help with their like the difficulties at this moment. And then the other one is like sometimes people will talk to me like, oh, I don't want to go to counseling because the counselor will put me on medication. Yeah, so I think it's, I will assume that you probably like realize like all my sentences they are false. Yeah, I try to make it like more like I was like, no, I can't. So yes, yes. So we, yeah, so like as a counselor, especially at UCC here, we don't prescribe you medication. We might suggest you to see a psychiatrist if we think like it will really benefit you. Yeah, and then the psychiatrist, they will do the work. But one thing we want to like emphasize is like we do not, and then we will not force you to take medication, right? We will talk about that. We will have some discussions, and then eventually it's you who decide like, okay, I'm going to try the medication or not. Yeah. And then the other one is like sometimes people will think like counseling is a quick fix for everything. So I have a lot of students approach me and then say like, okay, tell me what to do. And I just need one-time counseling. Sometimes, yes, we just need one-time counseling. But a lot of time, sometimes it depends on the things that bothers you, right? Sometimes you might need more time to explore your ideas or other people's ideas or the resources. So, and then also like everyone's experience is different. Even though you come with academic stress, the same with the next students, but everyone's situation is unique, right? So it will sometimes just take some time. And then something I also want to emphasize is like strengthening like your brain through counseling is like strengthening your body through exercise. So it takes time, practice, patience, and persistence. So
So in terms of what we offer at the UCC, well, first we're located in St. William Hall on the 3rd floor. So the first floor is University Health Services, and the second floor is McWell, and we're on the 3rd floor for the counseling center. I put our website on there. I won't go over it with you today for time, but I was wondering if we could send you our slides and you could distribute them, so then everybody would have this information. Would that be okay? Thank you. So I'll just review some of the highlights. So how to access our services. If you've never been a client at the counseling center, you would use our drop-in service, which means you don't have to make an appointment. You go up at the counseling center, say you need a drop-in appointment, you'll be asked to fill out some paperwork, and then you'll meet with a drop-in counselor. And the point of that is to get more information about what's bothering you, what your needs are. We do a safety assessment, and then we'll review some of your service options, what might be best for you. So I handed out, let me actually handed out a card that has our drop-in hours on it. And if you flip to the back, it gives you some crisis resources. So any, blue card. Yes, blue card. If you are seeing a counselor at the counseling center, you are still eligible to use drop-in if you need more immediate assistance. So let's say you don't see your counselor for 2 weeks and an emergent issue happens, you can use drop-in for those reasons as well. We also offer after-hours crisis service, which is the same phone number that you'll find on your card. If you call that phone number, you'll be able to speak to a crisis counselor over the phone. And that's weeknights after 5 and on weekends as well. So you can get basically a 24/7 service in one way, shape or form. In general, the services that we offer, we have individual counseling, we have group counseling, we have workshops on different types of topics. We also have, like she mentioned, psychiatry. And if you go to our website under services, it'll give you the, broad list of what we offer and then descriptions. So one of the things that we've had in the past is an international student support group. And the person who used to facilitate that has since left. However, we have two lovely women in the room who are talking about doing the international support student group again. So I guess TBD at this point, but figuring out a day and time, and then of course we would let everybody know. I wanted to highlight Let's Talk, which Whitney also gave you a card specifically for Let's Talk. So let's say you're still hesitant about coming to the counseling center, but you might want to meet with one of our counselors, and maybe you have like a quick question or just a need for a quick consultation. Let's Talk is something that you could use. So we have it at different sites around campus. It's not at the counseling center because we want it to feel more comfortable. And whatever site you would go to, you would meet with one of our Let's Talk consultants who also happens to be a counselor at the counseling center. And that can just be one way to meet a friendly face. And again, get a quick consult without having to become a client of the counseling center, at least initially, unless you want to. We have lots of self-help resources on our website. TAO stands for Therapist Assisted Online. That's another way to work through different modules for whatever your concerns are, and it's self-paced. And so you can do it really anywhere. So you can pick like the anxiety module, and then it'll take you through information and videos and things that you can do to cope and manage. I gave you our crisis information already. You all have a brochure of the counseling center, so I'll give you just general information as well. We also have some services outside of the UCC. For example, the university has partnered with a third-party vendor called Timely Care, and it provides telemental health services to students. So if you didn't want to come to the counseling center, or you just preferred having telemental health services, you would use Timely Care, and they have therapists and they have medication providers. And then I think they have some online like support groups, or thematic groups as well. You get 12 free individual sessions per academic year. After 12 sessions, if you wanted to continue with the counselor you've been meeting with, it's about $79 per session. But 12 sessions would get you through a whole semester every week, or you can spread them out. How to register for Timely Care is also on our website. We also have relationships with therapists who are in private practice off campus. So if you needed to meet with somebody who had a particular specialty area that we didn't have somebody on staff that could help with, or you were looking for meeting with somebody for longer term therapy, somebody you want to meet with regularly over several years, we have connections with people that we could help you, meet or get in touch with. Again, we can help you through that process. I just wanted to highlight two campus resources because they're the ones that the counseling center probably works with the most often. And that's the Center for Student Support and Care. And underneath that umbrella, there's the Care and Wellness Consultants, and then there's Sarah Bay Accessibility Services. So Care and Wellness Consultants are, I would just say they're like the generalist of support people here at the university. So they can help you with accessing resources, talking to professors, anything that you need in terms of like, are you re-entering university after time off? I mean, really, it is like, if you go to their website, they help you with lots of things, and you can schedule an appointment online. The person that you would meet with is based on the college that you're in. And so there's one person who is for the graduate school. So if you were online, you could see her name and then make an appointment with her. And then Sarah Bay Accessibility Services, or if you would need academic accommodations. So if you have, a diagnosis, let's say, for example, ADHD, and you needed some academic accommodations as such, for example, you needed more time to take exams, this is the office that you would go to in order to talk to somebody about getting those accommodations. We don't need to be involved in that process, but if you are a client of the counseling center, we can help you get registered there as well. There are lots of other campus resources, but again, I just wanted to highlight these two because we work with their offices most often. And that's it for us.
Thank you so much to our speakers. Really appreciate you guys, both your offices, representing today, and thank you all for attending the first event of ISSA's Info Blitz. If you guys have signed up for another one of the events this week, we'll see you then. Lunch has arrived, and there's a lot of it because more people RSVP than showed up. So please feel free to take a sandwich, and there's some plates for some of the dips, and there's pita. So please help yourself. Feel free to stick around and mingle for a little while. Part of this is also to help people get to know each other. So feel free to introduce yourself to your fellow students. And thank you so much for coming. We'll see you later.
Thank you.